everyone. We'll be looking at changes to drug plans in 2025. This will give you a good idea of what you'll need to know moving forward. All right, so the goal of this presentation is not to scare you, but just to educate you early. That way you can plan for the annual enrollment period that's coming up in October. Again, all Medicare recipients should be working with a trained and licensed agent that is knowledgeable about drug plans and has advanced training in drug saving strategies. That way they can help you navigate the complexities of drug plans. All right, so the next two slides, we'll see the shift in the cost of prescription drugs going from Medicare and the recipients of Medicare to the drug plans, and then also the manufacturers of those drugs. And then while it may look a little overwhelming, again, it's necessary just to understand what's going on and how this can affect plans and make adjustments to those plans. All right, so you'll see here we're in 2024. So in the deductible phase, you're paying 100%. Then you'll move to the initial coverage phase where you'll have 25% of the cost, and then the drug plans have 75%. We do have the coverage gap still, so you'll notice that there's still here a payment within that gap, and then once you hit catastrophic, there's an 80-20 split, 80 for Medicare and 24 drug plans. Well, in 2025, you'll still have the 100% payment by members, and then we'll move into the initial, and you'll see it's a split between the plans, which is at 65%, 10% for drug manufacturers, and then 25% for members or for you all. We're closing the coverage gap and then just moving into catastrophic. So here you'll see once you've hit your $2,000 out of pocket, so you've paid your 25% in that phase plus 100% deductible. Then you're moving into catastrophic, where it's a split between the drug plans, which will be paying 60, 20% for the drug manufacturers, and then 20% for Medicare. So you'll notice a big drop from what Medicare is paying between this year and 2025. So looking at the timeline, in 2023, we had the drug plans having coverage extended to vaccines. So there will be no deductible or cost sharing that could be charged for adult vaccines that were recommended by the Advisory Committee on Immunization Practices. And then you also have the Insulin Savings Program. So some of you may be utilizing that this year through your drug plans. And here the out-of-pocket cost for insulin must be capped at $35 per month supply. Now understand that applies for the insulins that are on the formularies. And that's just basically a list of drugs that is covered per plan. So it's important to make sure you check and see which insulin's on your plan as well, because some people ran into having issues with that because they were on the insulin that was not on their plan formulary. All right, in 2024, let's see here. So once the enrollee, which would be you all, hits catastrophic cost sharing for the remainder of the year, there's $0 due when you pick up your meds, whereas it was previously 5%. So that was a cost saver for people too. Well, now we're going to take a step forward, and in 2025, you have that $2,000 cap on that max out of pocket for prescription. So that's a drop from 8,000 in 2024 to 2,000 in 2025. And so you're eliminating the coverage gap, aka the donut hole, and then also having a change in cost share where you're shifting from Medicare paying 80% of the drug costs in catastrophic phase or the catastrophic phase of the drug plan, and it's dropping from 80% to 20%. So that'll be a savings for Medicare. And that undoubtedly has an effect on prescription drug plans, whether it's part of a Medicare Advantage plan or standalone prescription drug plan. So with this new legislation, there are adjustments that need to be made by the drug plans and then also by the manufacturers. So how this may look for you all, it may mean higher premiums, maybe fewer plan choices, maybe stricter formularies. So that means there may be some prescriptions that are not going to be on the formularies. And then also you have more drug utilization reviews. So that would be your prior authorization, step therapy, and quantity limits. And we'll dive into that shortly. All right, so with higher premiums, so if you have a standalone prescription drug plan, those premiums are going to go up, and we're not going to know what those premiums are until October 1st. So once we know that, then we're able to share with our clients. And so you may have heard people saying that the premiums are going to be capped at 6% per year. That's not true. What is used is a base beneficiary premium. Now that would be capped at 6%. And that's only one piece of the equation that's used in the bidding process between Medicare and the plans. And so that really doesn't have an effect on what your actual premium will be. Just know that the plans can increase the price of the premium still, and it can be more than 6%. All right, so again, we look at the price of the plans being affected. Also, the deductible. We're anticipating the drug deductible for plans to be $590. And then the formulary changes as well. So there may be some prescriptions that are removed from the formulary, especially if there's a generic available or something that, will be more cost effective for the plan. So we won't know until October, and that's when we'll be able to share that. And certainly, if you have any questions today about this information, definitely let me know. All right, so in terms of fewer plan choices, so at this point, we don't know what plans will be affected and how. We won't know how many of the standalone prescription drug plans will be available for 2025 in your area. So it's reasonable to expect that there are going to be fewer plan choices, and it's also reasonable and anticipated there may not be any low-cost plans in 2025. So you'll have to decide what you can afford. So how much can you afford for your plan premium? You can elect to go without prescription drug plans, but that's not a good idea. You never know if you'll have a costly medication that comes up. And again, Medicare does penalize you if you go without a drug plan. So again, this is certainly something I can help you with. Look at both reviewing what medications you have, and then what plans you may need to look at. Most people will be doing that for the 2025 plan year, but by all means, definitely, if you're interested in hearing more, just let me know and we can go from there. All right, so now we're looking at the formulary. So with the formulary, it is a list of prescriptions that are covered by the plan. each plan does have its own formulary. So even within one insurance company, each plan would have its own formulary. Medicare requires plans to cover at least 2 drugs for each drug class, except for the 6 protected drug classes where they must cover most of those drugs in that class. So that includes immunosuppressants, antidepressants, antipsychotics, anticonvalescents, antivirals, and anti-inoplastics. So, in order to contain drug costs, definitely anticipate formularies becoming more restrictive, and you may have to be more flexible when looking at medications on the formulary for your plan. And again, if there's any questions, I can definitely assist you with that. All right, so more drug utilization reviews. So, with prior authorizations, this is when you're required, um, by the plan to, just get more information from the drug, about the drug from the doctor, and the doctor's authorizing the fill. And it usually looks like the doctor saying, this is why this person needs this prescription. It's just an extra step before you're able to get your prescription. And definitely expect more prescriptions to require these authorizations. And that's across plans, not just, one particular plan. That's across plans. Again, we'll know more in October of how plans will be affected. And then you have step therapy. So this is when there are multiple drug options, to say drug A, B, and C. Step therapy will say, okay, try A, fail at using that before going to B, and then failing, basically saying it doesn't work for you, and then going to C. So stepping up, not just saying, oh, well, I want to try drug C, you're on drug C. So there's going to be more steps involved. And then quantity limits. So with this is when the plan will limit the number of pills per month. Some of you may have already noticed some prescriptions may be limited to 30 or 60 per month. We'll expect more of that taking place. And again, this is more of a response to the capping of the prescription drug costs, as well as, plans trying to control their costs. So understand with the quantity limits, if you try to exceed the quantity during the month, then a prior authorization would be needed for another fill. All right, so again, anticipate a need to review your plan for 2025. Certainly, if you are interested in looking at an appointment, you can certainly opt to reach out to do that. You can certainly take a look at that. If you want to look at it beforehand for this year, you can do that as well. And then remember that the annual enrollment period does start October 15th and ends on December 7th. So certainly reach out and let us know how we can help. And then this is my contact information. You can email me, you can call or text either of these numbers here. You can also visit our website. And it was certainly a pleasure speaking with you all. And I am here to help. If you have any questions, just let us know. Take care.